This isn't an ordinary public announcement. Residents in this village outside the Yemeni city of Aden are being told how to follow proper sanitary measures. And health workers are going door to door to educate their countrymen. Their message has never been more important, and it's volunteers like Mutab Salem who make sure the message rings loud and clear.
This is not correct. You should cover the container with a plastic bag. We're trying to change the way of doing things that will help all of us avoid this disease.
The disease is cholera, and Yemen is suffering the world's worst outbreak of the waterborne disease.
This campaign is going from house to house to let people know the importance of the messages that we are trying to give them. The messages we are trying to convey are personal hygiene, how to wash hands properly, how to use rehydration solutions, covering water containers that might be open. We advise the families of this information in a practical way and how to do the practices correctly.
And the families are listening. They, like more than half of all Yemenis, do not have immediate access to a functional medical center. It's made the cholera outbreak worse. More than 2,000 people have died from the disease this year, and the UN estimates at least 500,000 others have been infected.
Children in Yemen are facing the double burden of undernutrition and acute watery diarrhea. Agencies are working round the clock to ensure treatment and safe water. Over the next 2 weeks, 40,000 community volunteers will span out across the country, reaching 3.5 million households with messages on prevention against cholera.
Yemen is the poorest country in the Arab world. Its sanitation systems were already subpar compared with the rest of the region. But war there has contributed to the collapse of infrastructure in the country, and it shows no signs of ending. Perhaps it'll be the efforts of these volunteers that will help defeat this disease and keep the resource needed to sustain life from taking it. Rahul Radhakrishnan, TRT World.